Everyone to Chapter 22, Pharmacology, and today we're going to be discussing the pharmacologic treatment of mental illness, specifically the antipsychotics and the anxiolytics. So these medications are used to treat disorders like schizophrenia, severe anxiety disorders, psychosis, panic disorders, bipolar disorder. So psychiatric medications work by changing the neurotransmitters in the brain, and the most important neurotransmitters that we're going to talk about in psych pharmacology is going to be dopamine, serotonin, and GABA. Now, understanding how the medications affect these chemicals, that's going to help nurses understand how they work and what side effects occur with these medications and what complications to monitor for. First, we're going to talk about antipsychotics. They are medications used to treat psychotic disorders, especially schizophrenia. Psychosis means that a patient's disconnected from reality. So these are used to treat mental illness to improve thought processes and behaviors. This can include hallucinations like hearing voices, delusions, or like false beliefs. And the disorganized thinking would be, an example would be like, I went to the store sells shoes walk on the moon controls me. That's all jargon that doesn't make sense. Agitation is another that they may experience, and of course we all know what agitation is. Antipsychotics work primarily by blocking the dopamine receptors in the brain. So too much dopamine activity is associated with psychotic symptoms. So there's two major categories of antipsychotics, and they're typical and atypical, as you see there on the screen. So typical is called the first generation medications, and these treat positive symptoms. Now, positive doesn't mean something good. It is something's been added to normal behavior. They're symptoms that are extra experiences that should not be there. And they're usually caused by that excess dopamine activity in the certain brain pathways. Antipsychotics help by blocking the dopamine receptors, and that's what reduces the abnormal experiences. Now, those positive experiences, again, are hallucinations, delusions, and disorganized speech. Now, atypical, the second generation, treat both positive and negative symptoms. And some negative symptoms include lack of motivation, social withdrawal, flat affect, and poor self-care. So negative in this case is things that they've lost. So again, typical is an older drug. There's more movement side effects to those, and atypical is a newer drugs, and that's got fewer movement problems, but they're more metabolic side effects. Atypical antipsychotics block both dopamine and serotonin receptors. I want to make sure I told you that. And so that's why with the appetite, insulin regulation, things like that, you're going to see metabolic issues and side effects with the atypical. Antipsychotics continued. I'm going to break it down again. Typical antipsychotics are divided into two main groups, and I'm not sure I'm saying this word right, but it's phenothiazines. These medications block dopamine and norepinephrine, and because of this, they often cause sedation and orthostatic hypotension. They make patients sleepy and dizzy, and I saw a memory trick that said sleepy and swaying, so especially when they first start this therapy. The non-phenothiazines, these mainly block dopamine receptors only. An example of that is haloperidol or Haldol. That medication is a very powerful antipsychotic. Atypical antipsychotics, these drugs block dopamine and serotonin. Because of this dual action, they improve psychosis, and they improve mood, and they improve the negative symptoms we just talked about. They also have a lower risk of severe movement disorders. The biggest complication of antipsychotic medications is the movement disorders, and these are called extrapyramidal symptoms, or EPS. You'll see that abbreviation. EPS occurs because dopamine is important for movement control in the brain. If dopamine's blocked, then those abnormal movements can occur. Some types of EPS is acute dystonia, which is like sudden muscle spasms, neck twisting, tongue protrusion, eye rolling, and this is a medical emergency. Akathisia, the patient feels extreme restlessness, and they may say, I can't sit still, and they pace constantly. Tardive dyskinesia, see this on the commercials a lot. That's the late developing movement disorder, and they may have things like lip smacking, tongue movements, and facial grimacing, and this condition may be permanent. You do want to know about tardive dyskinesia. And then the neuroleptic malignant syndrome, NMS, this is the most dangerous complication, and the symptoms of that is high fever, severe muscle rigidity, altered mental status, and autonomic instability, and this is a life-threatening emergency. You want to make sure you know that. See the list of typical antipsychotics. Side effects are all very common. I'm going to wrap that up with severe EPS, sedation. Notice with the fluphenazine, some of the side effects there is dry mouth, blurred vision, weight gain. And then the last one, the side effects are strong sedation, low to moderate effect on blood pressure. Moving on. Fluphenazine actions, blocks dopamine receptors in the brain, used for managing symptoms of psychosis, including schizophrenia, as you see there on the screen. Side effects, dizziness, headache, blurred vision, going on, dry mouth, EPS. Serious effects that you may want to be monitoring for is the EPS and sometimes bone marrow suppression. Haldol, one of the most commonly used antipsychotics. It's very effective for the acute psychosis, and it works by blocking dopamine receptors. It's used in schizophrenia, psychosis, severe agitation, Tourette's. Nurses should really use caution in patients with glaucoma, cardiovascular disease, liver disease, and CNS depression. Side effects of Haldol, the common ones are drowsiness, headache, dry mouth, blurred vision. Cardiovascular effects are tachycardia and orthostatic hypotension. Other possible effects are constipation, urinary retention, sexual dysfunction, and most important complications is those EPS symptoms, and these are very common with Haldol. So clinical judgment, the concept is cognition, and recognize cues, assess the baseline vital signs, and obtain a health history, including the present drugs that they're taking, analyze cues and prioritize hypothesis, confusion, decreased ability to cope, or any disorganized thinking you may see. Some desired outcomes, you want to know this, that the patient communicates clearly, appears calmer, and shows improved thinking. Know your desired outcomes. So the nursing action, monitor the vital signs, mental status, side effects, observe the patient taking the medication, ensure that they are adhering to their medication regimen. Patients need to be educated that antipsychotics take weeks to work fully. Full therapeutic effect may take 6 weeks or longer. And patients should also avoid alcohol, opioids, and any other CNS depressants. These increase sedation and can cause respiratory depression. Atypical antipsychotics. The advantage of these medications is they're newer. They treat both positive and the negative symptoms. They lower the risk of the EPS. These medications block dopamine receptors and the serotonin receptors. And however, they do cause the metabolic side effects we talked about earlier, the weight gain, diabetes, and I don't know if I mentioned this one, but dyslipidemia or cholesterol issues. So nurses need to be monitoring blood glucose, lipid levels, and weight on these. Clozapine is used for severe schizophrenia or treatment-resistant schizophrenia. Means that patients did not respond to other medications. Some common side effects are the dizziness, drowsiness, constipation, and tachycardia. The most important complication is agranulocytosis, And this is the severe white blood cell suppression, so patients must have regular WBC monitoring. Make sure you know that. Risperidone, it's used for manage symptoms of psychosis, treats positive and negative symptoms of schizophrenia. Some of the side effects, again, dizziness, drowsiness, headache, and weight gain, and patients may also experience anxiety, akathisia, and GI upset. Okay, so aripiprazole, or better known as Abilify, treats several psychiatric conditions including schizophrenia, bipolar, depression, autism, and Tourette's. Some side effects you may see with this is drowsiness, anxiety, insomnia, and GI upset. Movement disorders are less common than older antipsychotics. Anxiety disorders. Some common anxiety disorders that we'll talk about throughout this section is the generalized anxiety disorder, social anxiety disorder, OCD, obsessive compulsive disorder, panic disorder, and PTSD. Some symptoms of excessive anxiety include sweating, palpitations, and shortness of breath. Behavioral symptoms would be restlessness, irritability, difficulty concentrating, and treatment includes therapy, lifestyle changes, and medication. Lorazepam, probably one that most people are familiar with. It is a benzodiazepine, and it works by increasing the GABA activity in the brain. Important for you to know, GABA is the brain's calming neurotransmitter. Again, important for you to know. Uses include anxiety, insomnia, seizures, and sedation. Side effects include drowsiness, dizziness, confusion, and weakness. And long-term use can cause dependence. Discontinuation. Benzos should never be stopped suddenly. The dose needs to be gradually reduced because stopping abruptly can cause some severe withdrawal symptoms. And these symptoms may begin 2 to 10 days after stopping. Withdrawal symptoms are they may experience nervousness, insomnia, tremors, sweating, and long-term or severe symptoms can be panic, delirium, hypertension, or seizures. So severe withdrawal can lead to status epilepticus, which we all know is a life-threatening emergency. So nurses need to be assessing for anxiety severity, and part of that assessment is going to be assessing for suicide risk, what type of support system they may have, their coping abilities, are they able to cope, and how. Signs of severe anxiety include insomnia, inability to cope, and panic symptoms. And as always, our desired outcome is for the patient to become calmer and better able to cope. When caring for patients taking the anxiolytics, nurses must monitor their vital signs, their levels of sedation, and any side effects. And then patients should be educated on avoiding driving or operating machinery because these medications can cause sedation. And they need to also be educated to avoid alcohol and any other CNS depressants. Buspirone, or I call it Buspar, is another medication used to treat anxiety, and it works different than the benzos because it acts on the serotonin receptors and the dopamine receptors. Some advantages of this medication is it's less sedation, lower risk of dependence. Side effects usually include dizziness, headache, nausea, or blurred vision, but unlike benzos, it does not work on GABA and therefore does not cause the same level of sedation or dependence. So Buspar does not work immediately. Patients need to take the medication for about 2 to 4 weeks before noticing improvement, and because of this, it's not useful for panic attacks or sudden anxiety episodes. It's best for persistent chronic anxiety, and that would be something you may want to jot down. And that is all I have on this slide. We will continue to break this down in the next week or two. Thank you.